Hello doctors, welcome back to Dr. Dentico YouTube channel, and today's topic of discussion is pharyngeal arches, which is most important in your embryology section, right? So this is most easiest topic and most important topic at same time. So you should know all about pharyngeal arches. So actually what is pharyngeal arches? So it is nothing but your embryological derivatives, right? From this only our all the structure will be derivated. That's why it is called as embryological derivatives, or we can also say it is precursors for our structure. So it's like a raw material which is already present to make something. What structures will be formed by pharyngeal arches? It can form your bone, it can form your cartilage, artery, muscles, all in the head and neck region. Okay, so we are going to see these structures. Now, see, this is a embryological structure. Okay, let me clear one thing. Don't judge me on my drawing skills. I'm very bad at my drawings. So, जैसा भी है चला लो प्लीज़. इससे ज़्यादा अच्छा मुझसे नहीं हो पाएगा. ओके फिर भी मैं ट्राई करूँगी. सो दिस इज़ योर embryological structure. Now see, this is your head fold, pericardial sac, abdominal and tail fold, right? Somewhere here you have your heart, and here we have our oral cavity, which is called as stomodium, right? Let me write here stomodium, right? Now surround the stomodium we have our 5 pharyngeal arches, or we can say 6 pharyngeal arches, because initially it was 6 arches are there, but after some time 5 will be disappear, so it will be 1, 2, 3, 4 and 6 number of pharyngeal arches. Now let's zoom out this picture and see here. This is your stomodium, right? Let me change color. Here we have first pharyngeal arch, second pharyngeal arch, third, fourth and fifth, right? Same on the opposite side, we have 1, 2, 3, 4 and 6. 1, 2, 3, 4, 6. So this we are seeing from lateral side in this picture, right? But here we are seeing from frontal aspect. Now if I cut end parts of this pharyngeal arches, what will happen? It will become blunt. So how it appears then? Like this, right? So this is your first, second, third, fourth and sixth. Same for opposite side, we have 1, 2, 3, 4 and 6. And in between this we have our stomodium, right? Now these arches are interconnected with each other. How? Like this, by forming a depression on both the side, outer side as well as inner side. Okay, so same for opposite, they are interconnected with each other. So this is your outer side. This is also your outer side. This is your inner side. This is also your inner side, right? So this outer portion is lined by a epithelium which is called as ectoderm, right? And this inner side, it is also lined by a epithelium which is called as endoderm. This epithelium is present in all the pharyngeal arches. Okay, I'm just drawing in this arch. It doesn't mean that epithelium is only present in this arch. So in between this pharyngeal arch structure is also lined by a epithelium which is called as mesoderm, right? Now see, here you have a depression. Same here, outer side you have depressions, inner side also you have depression. So what are they called? If depression is present on your outer side, it is called as cleft, pharyngeal cleft. Same for this. If it is present inner side, then it is called as pouch. Okay, so this will become your first pharyngeal cleft, second, third and fourth. And pouch is like first pharyngeal pouch, second, third and fourth. Clear? Again I am telling you, please remember this terminologies of ectoderm, endoderm and mesoderm. Why? Because from this only our structures will be going to develop. Let's move forward. Again same picture, we have our 5 pharyngeal arches and stomodium in between of this. Now this pouch and cleft, inner side pouch and outer side cleft will be invaginate, and due to that our structures will form. So how they invaginate? See, this is your cleft. So it invaginates in this fashion. Same here, it will invaginate like this only. Okay, and your pouch is also going to invaginate in this fashion. With the development process, this will come near to each other, and at the point of time they will attach with each other and form a structure. What are structures will form from here? Inner pouch area will give rise to middle ear and inner ear, and your cleft invaginate will give rise to external ear. Okay, how this will form? See here, they will attach with each other and form a septa here, right? Now see what happens, that ये आपको थोड़ा थोड़ा कान जैसा लग रहा है, ear, so it will form like your external ear. Okay, not actually external ear, it is your pinna now or auricle. After this is a tube like structure, right? So this tube like structure is nothing but your external auditory meatus. After this is a septum present over here, which is nothing but your tympanic membrane. And after this we have our this portion which is your middle ear, and then we have remaining portion which is your inner ear. Clear? So let's write it together. What structures are derived from what side? I will write here from cleft, and here I will write from pouch. So from first cleft, what are structures derived? External ear, right? And from pouch we have middle ear and inner ear. So now it's turned to our second pharyngeal arch. Now what happened with developing? This second pharyngeal arch, third pharyngeal arch and fourth pharyngeal arch will be pinch out. It means it will go inside. How? See here, we have our ectoderm over here, right? Now this pinch out. So it looks like this. Second, third and fourth pharyngeal arch. Again ectoderm. So same for opposite side. I will draw over here for second, third and fourth pharyngeal arch, right? So they just pinch out toward the inner side. So what happens with the developing? It will be formed septa over here and over here also. So this is your second, third and fourth. Here you have septa. So let's zoom out this picture. You have your ectoderm over here. Here you have your second arch, third arch and fourth arch, and it will be connected by a septa. Okay, so they are separated from each other with the help of septa, and in between this we have a structure over here called as cervical sinus. Why it is called as cervical? Because it is present in cervical region. That means in the neck. Generally it disappears with developing. But if it does not disappear, it will be called as cervical cyst, right? So here I can say this is a temporary cervical cyst because with the time it will going to disappear. That's why it is temporary, right? Now if this cyst persists with the developing, where will it present? In your neck. Exact location anterior to your sternocleidomastoid muscle. And what is this cervical cyst will do with you? It will just compress your surrounding structures and it will create a problem in our body. Okay, so that's why this cyst should be disappear with the developing. Only 2 to 3% cases are there in which we can find this cervical cyst. Otherwise, it will disappear. Clear till now? Now, let's move to the second pharyngeal pouch. So, it will invaginate like this. Okay, it will invaginate like this. So, this invagination, here some tissues are present in this and it is called as tonsillar bed. Why it is called as tonsillar bed? Because with the developing it will give rise to tonsils. Which tonsils? Palatine tonsils. Right? So, see one thing here. This is your oral cavity, right? Stomodium. So, oral cavity is present in the central portion. After developing also it is present in your midline. So, whatever structures are formed from pharyngeal arches, they are present in the periphery of oral cavity, right? So, here we have a palatine tonsil formed from second pharyngeal pouch. So, what is importance of second, third and fourth pharyngeal cleft? It will just give rise a temporary cervical cyst. So, let's write here second cleft we have temporary cervical cyst. And here we have palatine tonsils. Right? Same for third and fourth. They will give rise to temporary cervical cyst. So, now let's move to the third pharyngeal pouch. So, it will invaginate. How it invaginates? It invaginates like this. Here you have your dorsal wing and this is your ventral wing. This is your dorsal wing and this one is your ventral wing. Same over this side. Now, this fourth pharyngeal pouch will also invaginate in same fashion like this. Again, we have our dorsal aspect and ventral wing. Dorsal wing and ventral wing, right? Now, see over here. Here you have your thyroid gland. Again, I am telling you, don't judge me with my drawing skills. So, this is your thyroid. So, this dorsal wing will give rise to inferior parathyroid gland. Okay, this is your thyroid gland and just near to this dorsal wing of third pharyngeal pouch will give rise to inferior parathyroid gland. And ventral wing will give rise to superior. No, it will give rise to thymus gland. And this dorsal wing of fourth pharyngeal pouch will give rise to superior parathyroid gland. With the developing process, this parathyroid glands will cross. So, how they cross? This inferior parathyroid gland will come till this and set over here. And this superior parathyroid gland will go towards this and settle there. Okay? So, this is a crisscross fashion. Same for this also, right? Here it will come and set. Again from this side also, come and set. Okay? So, that's how your thyroid gland and parathyroid gland will form. In third pharyngeal pouch, we have two wings, dorsal wing and ventral wing. From dorsal wing, it gives rise to superior parathyroid gland, and ventral wing give rise to thymus gland. Then fourth pharyngeal pouch again have two wings, dorsal and ventral. Dorsal will give rise to inferior parathyroid gland, ventral give rise nothing. So these are the structures which form from our pharyngeal arches. In some patient, this third pharyngeal pouch and fourth pharyngeal pouch will not invaginate. So what happens? Because of failure of invagination of third and fourth pharyngeal pouch, there will be no parathyroid gland and there will be no thymus, right? No parathyroid gland, no thymus. That is called as parathyroid aplasia. And thymus gland is also not forming, which is called as thymic aplasia. Now, if parathyroid gland is not there, so PTH level will increase or decrease? It will be going to decrease. Okay, so decrease in PTH level. Thymus gland is also not there. What will be secreted by thymus? T lymphocytes, right? That's why decrease in T lymphocytes. What is the function of T lymphocyte? It is giving immunity to host, right? So there will be decrease in immunity. What is the function of parathyroid hormone? It maintains calcium level in our body, right? So if it is less of parathyroid hormone, then patient have decrease in calcium, and this syndrome is called as George syndrome. This is all about your pharyngeal arches for today. We will cover next part in next video. So if you have any doubts related to this, please let me know in comment section. And if you have any suggestion or you want any topic from me, let me know in comment section, or you can tell me on Telegram. We have a group over Telegram, and also you can DM me on Instagram. I will put all the links in descriptions. Okay. Thank you so much for patient listening.